121. The nurse should assess for night sweats in suspected TB cases. True or false? Answer. True. Rationale. Night sweats are a hallmark symptom of active TB, reflecting systemic inflammation, and should be assessed per clinical evaluation guidelines. 122. The BCG vaccine prevents latent TB infection. True or false? Answer. False. Rationale. The BCG vaccine reduces severe TB forms in children but does not prevent latent TB infection, per WHO vaccination efficacy data. 123. Patients with active TB should be isolated in a negative pressure room. True or false? Answer. True. Rationale. Negative pressure rooms prevent airborne spread of Mycobacterium tuberculosis, a standard for active pulmonary TB, per CDC infection control. 124. A single negative sputum smear rules out active TB. True or false? Answer. False. Rationale. A single negative sputum smear does not rule out active TB, as multiple samples or cultures are needed for accuracy, per CDC Diagnostics. 125. Ethambutol is used in the treatment of latent TB. True or false? Answer. False. Rationale. Ethambutol is used for active TB, not latent TB, which is typically treated with isoniazid or rifampin monotherapy, per WHO treatment guidelines. 126. TB can cause infertility in women due to genital TB. True or false? Answer. True. Rationale. Genital TB, an extrapulmonary form, can affect the fallopian tubes or uterus, leading to infertility, per clinical manifestations. 127. The nurse should teach TB patients to report vision changes while on ethambutol. True or false? Answer. True. Rationale. Ethambutol can cause optic neuritis, leading to vision changes, requiring immediate reporting for evaluation, per patient education guidelines. 128. TB is only contagious when symptoms are present. True or false? Answer. False. Rationale. Active pulmonary TB can be contagious before symptoms are evident, especially in early stages, per CDC transmission principles. 129. The GeneXpert MTB/REF test provides results within hours. True or false? Answer. True. Rationale. The GeneXpert MTB/REF test is a rapid molecular assay, delivering TB and rifampin resistance results within 2 hours, per WHO Diagnostic tools. 130. Patients with active TB can safely travel by airplane after 1 week of treatment. True or false? Answer. False. Rationale. Active TB patients should not travel by airplane until non-infectious, e.g., after 2 to 3 weeks of treatment and negative sputum, per CDC travel guidelines. 131. Malnutrition increases the risk of TB progression. True or false? Answer. True. Rationale. Malnutrition weakens the immune system, increasing the risk of latent TB progressing to active disease, per WHO risk factors. 132. The TST is the most accurate test for diagnosing active TB. True or false? Answer. False. Rationale. The TST detects TB infection but is not specific for active TB. Sputum culture or molecular tests are needed for diagnosis, per CDC Diagnostics. 133. Patients with TB should be monitored for drug-induced hepatitis. True or false? Answer. True. Rationale. TB drugs like isoniazid and rifampin can cause drug-induced hepatitis, requiring regular liver function tests, per pharmacological monitoring. 134. TB can be transmitted through casual handshakes. True or false? Answer. False. Rationale. TB is not transmitted through casual contact like handshakes, as it requires inhalation of airborne droplets, per CDC transmission routes. 135. A 10 mm induration on a TST is positive in healthcare workers. True or false? Answer. True. Rationale. A 10 mm induration is considered positive in healthcare workers due to occupational exposure risk, per CDC TST interpretation criteria. 136. All forms of TB are curable with standard treatment. True or false? Answer. False. Rationale. While drug-susceptible TB is curable, extensively drug-resistant TB, XDR-TB, has lower cure rates due to limited treatment options, per WHO data. 137. The nurse should teach TB patients to take medications at the same time daily. True or false? Answer: true. Rationale: consistent daily timing of TB medications ensures steady drug levels, improving efficacy and adherence, per patient education guidelines. 138. TB can cause a normal chest X-ray in early active disease. True or false? Answer: true. Rationale: early active TB may show a normal chest X-ray, especially in immunocompromised patients, requiring further testing, per radiologic findings. 139. Streptomycin is a first-line drug for TB treatment. True or false? Answer: false. Rationale: streptomycin is a second-line drug used for resistant TB, while first-line drugs include isoniazid, rifampin, pyrazinamide, and ethambutol, per WHO regimens. 140. TB can cause adrenal insufficiency in extrapulmonary disease. True or false? Answer: true. Rationale: TB can affect the adrenal glands, causing adrenal insufficiency, Addison's disease, a rare extrapulmonary manifestation, per clinical manifestations. 141. The nurse should assess for cough duration in suspected TB cases. True or false? Answer: true. Rationale: a cough lasting more than 2 to 3 weeks is a key symptom of pulmonary TB, requiring assessment, per clinical evaluation guidelines. 142. The BCG vaccine is effective against extrapulmonary TB in adults. True or false? Answer: false. Rationale: the BCG vaccine has limited efficacy against extrapulmonary TB in adults, primarily reducing severe forms in children, per WHO vaccination data. 143. Patients with active TB should have their sputum tested for drug susceptibility. True or false? Answer: true. Rationale: drug susceptibility testing of sputum identifies resistance patterns, guiding treatment for drug-susceptible or resistant TB, per WHO Diagnostic protocols. 144. A positive IgRA test indicates a recent TB infection. True or false? Answer: false. Rationale: a positive IgRA indicates TB infection but cannot determine whether it is recent or past, requiring clinical correlation, per CDC Diagnostics. 145. Rifampin can cause red-orange urine as a side effect. True or false? Answer: true. Rationale: rifampin causes harmless red-orange discoloration of urine and other body fluids, a common side effect requiring patient education, per pharmacological effects. 146. TB treatment can be completed in 2 months for active disease. True or false? Answer: false. Rationale: active TB treatment requires 6 to 9 months, including a 2-month intensive phase and a 4-7-month continuation phase, per WHO guidelines. 147. Smoking increases the risk of developing active TB. True or false? Answer: true. Rationale: smoking damages lung tissue and impairs immunity, increasing the risk of latent TB progressing to active disease, per WHO risk factors. 148. The nurse should use droplet precautions for active TB patients. True or false? Answer: false. Rationale: active pulmonary TB requires airborne precautions, not droplet precautions, due to transmission via small airborne particles, per CDC infection control. 149. TB can cause weight gain as a symptom. True or false? Answer: false. Rationale: active TB typically causes weight loss due to increased metabolic demand and systemic inflammation, not weight gain, per clinical manifestations. 150. The T-spot TB test is less reliable in immunocompromised patients. True or false? Answer: false. Rationale: the T-spot TB test, an IgRA, is generally reliable, though sensitivity may be reduced in severely immunocompromised patients, per CDC Diagnostics. 151. Patients with active TB should avoid contact with immunocompromised individuals. True or false? Answer: true. Rationale: immunocompromised individuals are at high risk for severe TB, necessitating avoidance of contact with active TB patients, per CDC guidelines. 152. A single dose of isoniazid is sufficient for latent TB treatment. True or false? Answer: false. Rationale: latent TB treatment requires 6 to 9 months of isoniazid or alternative regimens, not a single dose, per CDC treatment guidelines. 153. TB can cause pleural effusion on chest X-ray. True or false? Answer. True. Rationale. Pleural effusion is a common radiologic finding in pulmonary or extrapulmonary TB, indicating pleural involvement, per radiologic findings. 154. The BCG vaccine is mandatory in all countries. True or false? Answer. False. Rationale. The BCG vaccine is used in high TB burden countries, but not mandatory globally, with varying policies, e.g., not used in the U.S., per WHO vaccination strategies. 155. The nurse should monitor for peripheral neuropathy in patients taking isoniazid. True or false? Answer. True. Rationale. Isoniazid can cause peripheral neuropathy due to vitamin B6 depletion, requiring pyridoxine supplementation and monitoring per pharmacological side effects. 156. TB is only transmitted indoors. True or false? Answer. False. Rationale. TB can be transmitted in any enclosed space, indoor or outdoor, where airborne droplets linger, per CDC transmission risk factors. 157. A GON complex on chest X-ray indicates healed TB infection. True or false? Answer. True. Rationale. A GON complex, GON focus with hilar lymphadenopathy, indicates healed primary TB infection, often calcified, per radiologic findings. 158. All TB patients require directly observed therapy, DOT. True or false? Answer. False. Rationale. DOT is recommended for high-risk TB patients, e.g., non-adherent MDR-TB, but not mandatory for all, per WHO treatment protocols. 159. TB can cause hemoptysis in advanced disease. True or false? Answer. True. Rationale. Hemoptysis occurs in advanced pulmonary TB due to lung cavitation and vascular damage, per clinical manifestations. 160. Patients with latent TB always progress to active disease. True or false? Answer. False. Rationale. Only 5 to 10% of latent TB cases progress to active disease, often triggered by immunosuppression, per CDC epidemiology.